Time for the Orthopedic Minute, ladies and gentlemen, at 12 minutes past 7 o'clock right now. Welcome back to the show. Lou and Michelle here with somebody that I think a lot of people are going to be able to relate to, because it seems like at one time or another, Michelle, you have something going on with your feet, especially your big toe.
That's right, and if your toe hurts, everything hurts.
It does, definitely.
Dr. Paul Butler joining us from DMOS in studio. Now, you're in the West Des Moines office?
West Des Moines and then up in Ankeny.
You're up in Ankeny as well?
Yep.
Perfect. And we're here to talk about some of the symptoms and the great pain associated with your big toe. Why does it seem like whenever anything happens to your toes or your feet, it's the big toe that is the first one?
It's just that, you know, when you're dealing with foot problems, it's that it affects everything in your life. And so big toe, it's, you know, the big one for a reason. It takes a lot of the pressure and support for your foot. And so anytime that's affected, it just really affects everything you do all day.
Right. Now, I know someone who recently lost one of their toes. And how important are toes for balance of the human body?
They all work together. And so a lot of times if there's, you know, one that is gone or something like that, people can try to compensate, and there's ways that we can make adjustments with shoe wear and inserts to try to balance that. But at the same time, they all do serve a purpose, and trying to get them to work together in an overall foot balance is important.
Okay.
And when we do have something with our feet, that seems like something that we tend to more deal with instead of actually going and having somebody look at it. Kind of talk about how important it is when you do have something to maybe go and see a doctor and kind of help get things alleviated.
Yeah, a lot of times, you know, people, they don't like talking about their feet. They don't like showing their feet.
They don't like people touching their feet.
Exactly. And so that's where somebody like myself comes in, is that with feet, everybody's feet are unique. And so kind of my opinion with it is that regardless of how your foot is, if it doesn't hurt, it's something that we don't have to necessarily evaluate regardless of what it looks like. But if you start having pain, there's a lot of different things that we can do, not just with surgery, but with shoe adjustments and inserts and so forth, that can help people be able to get back to their activities they enjoy.
All right, let's talk about some big toe pain and what some of the causes are possible.
Yeah, a couple of the big ones, especially with big toe pain, are bunions and arthritis.
Okay, now explain. I think people understand what arthritis is, but what is a bunion?
Yeah, a bunion, commonly think of it as a bump on the inside of the big toe. And what it is, it's an anatomic change of where two bones that used to be lined up parallel are now kind of spreading apart. And so it's still a normal bone, but it's just not aligned the same way that it used to be.
So this is from actually inside, you mentioned inside the toe. See, I always thought a bunion was on the outside of your toe.
Right, and so it's the bone on the inside that then points to kind of the inside of your foot.
Okay.
And then the big toe kind of usually pushes into the second one.
What causes that? I mean, are there things that you can do to prevent that?
It's hard to prevent. Have a new family, because genetics are one of the top things.
So first get a new family. Okay. Get some new DNA. Okay.
Yeah, and then it's most common in women. And so
really?
Yeah, and so
I never expected to hear that.
Yeah, and so those two variables, the female gender and then the family inheritance. And so,
wow.
Yeah, so we had a lot of people over holiday weekends that have, you know, hashed things out at the dinner table, I think, talking about thanks for this.
Thanks a lot for this, right? So there isn't anything you can do to kind of keep that
you know, we can, and the big thing is that we treat the symptoms. And so from a symptom perspective, it's finding shoes that don't press directly upon it. And so whether that's a different brand or different style, whether that be like a toe spacer, because the big toe can be pushing into the second one.
So toe spacer?
Yeah, and there can be silicone implants that you can put so then their toes aren't rubbing on each other.
Okay.
To take some of the pressure off. Or an arch support, because it does change the stabilization of your arch, and that can cause fatigue and achiness in your foot. And so there's a lot of things that we can do, and I'd say in the grand scheme of things, most patients we're able to find something that works well for them that is non-surgical. If those things don't work, you know, we say easy things first, hard things last, then we transition over to the surgical options. But most patients don't even need to get that far.
Is a bunion something that continues to get worse, or does it kind of get there and then
it can
stays?
And so so it's very patient dependent. And so from if let's say somebody has it when they're 25 and they say, oh man, I should do something about it now before it gets worse, there are some patients where it stays kind of static and it doesn't necessarily get worse, and we can continue with those conservative options. There are some people where, you know, maybe the bump doesn't get worse, but the achiness and foot fatigue and so forth changes over the course of their life, and so then we do something in the future. But I feel that by treating what your symptoms are rather than the bump, if it doesn't cause a problem, is the most important thing, because some people you necessarily don't need to do anything for.
Okay, now you mentioned some of the real basic things that could alleviate some of the pain and discomfort. You mentioned shoes. What type of shoes? what type of shoes would be best for somebody that has this problem?
Right. And so I think a big thing is really just going into your local shoe store and trying on the shoes of different styles, different brands, because everybody's foot's different.
You're just trying to avoid constricting the toes? Is that the deal?
Exactly. And so causing, direct pressure. And, as a male, our shoe choices are a little bit more lenient than women commonly. And so that can be problematic.
We choose more for aesthetics sometimes than the better
Guys choose them for function.
And that's okay. And that's okay. And I say, if you're going to an event or you're going to work and you say, hey, I can tolerate it, that's okay. But at the same time, we deal a lot with quality of life. And so if the pain is so significant that you're not enjoying things, maybe that transition away from that favorite pair of shoes that you have is a good idea. And you can still wear them periodically, but if it's driving you nuts, then maybe we should try something else.
And if your feet hurt, it affects your activity, it affects kind of how you move, and then that can cause other problems, further up in the body because you're adjusting because your feet hurt. And so forth.
Because the little kid song, knee bone's connected to the hip bone, it's true. Everything is connected up the chain, and your foot's the thing that hits the ground, and then it transmits up. And so if your foot's malaligned and you have pain, then you can get knee pain, you can get hip pain, low back pain.
Right.
And so it is really all connected.
Wow, it's amazing. But again, if worse comes to worse, and none of the things that we talked about are effective, surgery is an option.
Surgery is an option.
And will that alleviate the pain then in most cases?
Yeah, it works well for a lot of patients. And so when those options when the non-surgical options have failed, surgical options of whether it be from an arthritis perspective, of removing the bone spurs, whether it be putting in an implant or something like that to help create space where that arthritis was, or fusion, or from a bunion is realignment, where you correct how the foot's supposed to look and you take that bump away so it's not rubbing on shoes, and also provide the stabilization to the arch that your foot wants. We can get those symptoms.
So something can be done.
Definitely.
That is awesome.
Definitely.
And DMOS is the place to go.
We're there for you.
Now, how do we get a hold of the folks over at DMOS? Just jump online is what you do. That's the correct answer here, folks. DMOS, just check them out. DMOS.com, really simple. Again, you have the West Des Moines location, and also you practice up in Ankeny, too.
Yep, correct.
Perfect, wonderful.
Dr. Paul. Take care of our feet.
There we go.
Give them much greater respect, and if there's a problem, go get it checked out.
And Dr. Paul Butler will be your big toe, okay? And he'll take care of you, right?
Sounds great.
That's how it works for me.